Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today is January 27, 2023. With the Falmouth Health Department doing our every other week COVID-19 update. 6,177 PCR positive. Again, this is PCR only. There is going to be a lot more cases over the last year that does not show into this number as a result of home tests that are not contact traced, so this is just PCR. You see a lot of PCRs used in healthcare, nursing facilities, assisted living, hospitals, people going in for procedures, and other congregate care. So I think that's where you see more, and then people that just want the accuracy of a PCR. I think the most sort of the general public would be using home kits. So the number of cases isn't really known. I think just when PCR goes up, you can make the assumption that, generally speaking, COVID's gone up. So I think you just say, up or down in the direction that we're going with PCR is a better way to look at it. So this sheet's all based on PCR. There were 85 confirmed PCR cases during the 14-day period, down from 105. Last 4 weeks, we were around 45 the last two, and a little over 50 before. So we're somewhere in the last about 48 and a half or so cases over the last 4 weeks per week. So that's not bad. So 85, I think last week what I said 105 for the last update, which would put us at about 200. Yeah, so somewhere around 48 or so cases in the last, per week, I'm rambling here, per week over the last 4 weeks. The incidence rate among PCRs are down by 4.6. It's a pretty good decline. Pretty flat with positivity, up about 0.4%. Again, these are only PCR based test results. The better thing to use is this chart here, which is the CDC guidance on community levels of transmission, which uses hospitalizations because those numbers are real. Somebody going into the hospital that has COVID, it's, or is either, ancillary to why they're going to the hospital or the reason they're going to the hospital. We know those numbers are a bit better. We remain in the medium. A couple weeks ago we hit high. We've been in the medium for a couple of times now. Pretty good decline in those numbers, so it was a pretty good decline over the last 2 weeks in the number of hospitalizations, so the burden on the hospitals is a bit better. Coming to the next chart I like to show is this is the entire pandemic for hospitalizations. At the far left, you see that fatter, sort of short, the big first bump, which is a little bit wider, which would be the Delta of 2021. So that's with mitigation. So that's with shutdowns, with mask requirements and so forth. They still ended up with a hospitalization rate that was at that high. Relative to the cases, there was a lot of hospitalizations relative to the cases as compared to the sharper spike of the Omicron in January of 22, which is the second spike, the more acute spike. That one would be just the sheer boatload of cases. So there was a lot more cases of COVID in January of 22 than there was in January of 21. We didn't have as many mitigation measures and the spreadability of Omicron, even though the hospitalization was, relative close to each other. It was because of the sheer number of cases in Omicron and the intensity of it in Delta. Now, going all the way to the far right, you can see this is where we are for this year. So I think if you look at the chart, the one thing you'd say is January is our worst month. It has been for the last 3 years, the 3 years that we've had COVID. January's been the worst month. But this one, look at this one, after vaccines and boosters and no mitigation, no shutdowns, no masks or anything like that, per se, or requirements, you see that the bump is a lot less, but still a bump nonetheless. So it looks like we've come up, and in the last week or two we've gone down. And that January, right, early January is where the peak of these spikes are. So the trend continues. It's just, thank goodness, it's a lot less. And so that's why I like to show this chart, because it really does show the pandemic in a nutshell, that now that we've got the vaccines and the boosters, and we've got the Omicron bivalent vaccine, you see an increase, because coming out of the holidays, everybody gets together, you meet with people you don't see all year, and you travel and things of that nature, and that's, school vacation week and all that fun stuff. You don't get what you got in that prior January. So our incidence rate is sort of middle of the road, maybe a little on the high side rather, middle of the road would be somewhere around 15 or so. We were at 19, not off the chart, but, in sort of the higher end of incidence rate. Positivity, we're somewhere in the middle to high range for the rest of the county. Again, these are always only PCR based. Statewide, there's 5,797 cases. It was 9,000 last time I did this. So there's definitely a drop in cases among the state. The trends are pretty good. If you look at the trends at the far right, you see that hospitalizations are starting to tick down in the state. Cases are ticking a bit down. Testing positivity is ticking a bit down, pretty flat for deaths. That's a lagging state from the blip. So when you see that little increase in hospitalizations, that would result in a bit of an uptick with deaths because that's, people are sicker with it. So you're going to see a little bit going up when you do have hospitalizations go up. Wastewater. Wastewater is a good indicator of community amount of COVID in a community. I'm just using the MWRA, which is the greater Boston area. The orange is the southern areas, and the North Shore areas are shown in green. And it just shows you a trend, shows you that Omicron was way off the charts a year ago, didn't even show up on the chart, so far off. But you can see, look at the far right, you can see it's sort of a downward trend. So we see a downward trend in cases, trends, and in wastewater coming off the peak of early January. And again, this has been 3 straight years that's sort of been this case. As far as boosters, there's a bivalent booster. Anybody over 5 years and older, you'd still get your primary series, would still be the monovalent, okay, and then you would get bivalent boosters after that. Okay, so there's plenty of boosters around. Just go on vaxfinder.mass.gov. There was quite a bit of vaccine available. Just register on there with a local pharmacy, I think Convenient MD if you go on their website. There's community health centers that do it. There's places that do it. There's just are enough places that you should be able to get it by just going on vaxfinder.mass.gov. Testing, most people using home kits. I just got a bunch of home kits delivered by the state. We got them for free, so I've give some to the service center is going to get some, the senior center, we have some at Town Hall, so maybe some other places as they come up. So, we've been able to pick up some extra tests, but you can also still get a PCR Convenient MD. The pharmacy still have the testing, the hospital still does their testing. So there's still a testing availability. Most people are using the home kits. Vaccines, moderate, 283, most in the booster category. Still a little low on boosters. I just would recommend people if you were pro-vaccine and you took your first series, there's definitely a drop-off between your first series and then when people start to get boosters. We only got about 31% of the town have gotten their second booster. So, and that might be one of the reasons why that, the hospitals got into the medium category because, if you haven't been boosted, then you're relying on a vaccine that you would have gotten maybe 20, 21, 22 months ago. So it's sort of waning, and it was not for Omicron. So if you're pro-vaccine, and you just haven't gotten the booster or gotten around to it, it'd be a good time to get your booster. As far as what is out there for variants, it is the XBB 1.5 is pretty much in this region of the country. The primary one somewhere around 90% or so, and so. Not that it matters right now, these sort of all act the same, but right now the XBB just took over the BQ.1.1, and there's like this every couple of months it sort of changes variants, but they're all in the Omicron family. So as a recap, the counties remains medium, it's trending lower, pretty much everywhere in the state, including us, trending lower. Plenty of vaccines, plenty of tests. The boosters are, there's plenty of things out there for that. The XBB is a dominant strain. There are no new mandates in town. There are nothing new, nothing coming down the pipeline about anything like that. Again, we have some home tests. Also, you can easily pick up your home tests, test if you're not feeling well, especially if you've been exposed. And, that's my update for the week. And we'll do this again in a couple of weeks. And thanks. Bye.